So this week I showed you all the substances that are destroying our Nigerian youths. So today, the question that ties all of this together: should drug users go to prison or should they go to the hospital? I have a clear answer, and it's based on evidence, not emotions, and not based on sentiments. Okay, let's look at the current situation we have in Nigeria today. Under the Nigerian law, drug use and possession are criminal offenses. Okay, the Nigerian Drug Law Enforcement Agency (NDLA) arrests, prosecutes, and imprisons drug users alongside the drug traffickers. You see, our prisons are now full of people with substance use disorders who actually need treatment and not punishment, and the drug problem continues to grow. Let's talk about decriminalization. What's decriminalization? First of all, I want you to know that decriminalization does not mean the same thing as legalization. Decriminalization means that you are removing criminal penalties for personal use and possession while keeping trafficking and supply as criminal offenses. I will explain. If a drug, let's say cannabis, is legalized, is decriminalized in Nigeria, you know what that means? It now means that people who have maybe cancer, people who need cannabis to medicate the effects of cancer, people who need medicinal cannabis for chronic pain, people who need medicinal cannabis for other medical conditions for which they find relief, can actually buy it and use it without being tagged as criminals. When cannabis is decriminalized, it means that people who want to do research on medicinal cannabis, who want to find out the other medicinal properties that are inherent in cannabis, can have access to that substance and do research on it without being tagged as criminals. But while that is happening, those who are trafficking it into the country, those who are involved in the importation or the exportation, they can still be arrested as criminals. So you are removing the criminal penalties for people who need it for legitimate reasons, while you are still criminalizing other categories of users. That's it. Hope that's clear. Okay, so a person that is found with a small amount of personal use will be referred to treatment and not prison. And even the prison officials, when they see somebody in the prison who they know their problem is actually due to the use of substance, they will be able to have the knowledge and the wherewithal to take that person out and send him to the hospital where he can get treatment and rehabilitation and not be punished. So let's talk about the evidence. In Portugal decriminalized all drugs in 2001, and they had very remarkable results. Drug use fell, HIV infections fell dramatically, drug-related deaths decreased, medical conditions that are following the use of injectables, needles used for injecting different kinds of opioids and other kinds of psychoactive substances, all those things reduced. People began to take up treatment. Treatment uptake increased. People taking up treatment for use of substance use problems. They were having increased numbers in the hospitals because people were no longer afraid to seek help. In Switzerland, in the Netherlands, and several other countries, they have also adopted these similar approaches with positive medical and psychiatric health outcomes. So if you ask me, where do I stand? I would say I support the decriminalization of personal drug use in Nigeria, combined with mandatory investment in community-based treatment, harm reduction services, programs, and even public education. A prison cell does not treat addiction, and punishing a disease has never made anyone well. So if you're watching me, or you have been watching this series up to this point, and you know in your heart that there's someone in your family who needs help and not prison, but you don't even know where to start from, you don't even know what to do, this is your moment to take the next step. Episode 6, I told you, is specifically designed for families who need to know what next step to take, and it's available only to subscribers. That's my most practical episode. It walks Nigerian families through exactly what to do when a loved one is struggling with substance use, step by step, with the legal and the clinical guidance. Subscribe for only 3,600 naira. Link in my bio. 5 days, 5 conversations Nigerian needed to have. Thank you everyone for watching. Share this series with everyone you know, because awareness is where the change begins. Tomorrow is the final episode. Subscribers only.